So, Dr. Berger, is this similar to what you're reading about and also seeing firsthand?
Absolutely. I've have patients that are. I have one patient who is a competitive athlete in track, and usually would run 5 miles a day, and is unable to run 1 mile a day without getting winded. And thankfully, over time, we're seeing as you wait, the symptoms do alleviate. But it takes time, and the story is still not complete. We haven't seen what the ultimate effect is going to be, but the signs are encouraging that they do eventually get better, but we don't know for sure.
And
See,
I think a lot of parents hear the news about myocarditis. Obviously, we know the CDC is going to be taking a look at that, and they say, if I'm going to weigh, what are the risks for my child getting a vaccination? What would you say to that point?
so the risk of myocarditis is we're seeing it perhaps in some of the younger boys. Younger boys meaning uh, late.
Okay, your mic just
Just
cut out
above
right there. So can you just repeat that? You said younger boys, but you mean over the age of 12.
over the age of 12 of the people that are vaccinated over the age of 12 to the low 20s, and it just seems to be above the rate of background, meaning if you take a million kids that are not vaccinated, you're going to see a certain number of kids that get myocarditis just from summertime viruses. It's normal, we see it, and we're seeing it now in the kids that are. If you take a million kids that are vaccinated, we're seeing maybe just a few more that are getting myocarditis. But if you take a look at the ones that have myocarditis versus the ones that get COVID, it's really not a competition. The risk is so much greater of getting COVID than it is for getting this myocarditis. And I might add, it's basically a mild inflammation in the muscle of the heart, and the children seem to be getting better on their own in the next few days without intervention for the most part. So it's temporary, it's self-resolving, and the risks are much smaller than the risk of getting COVID.